Early and effective treatment of stage 4 pancreatic cancer symptoms. Hello, this evidence-based content is prepared by Saboor Khan, fellowship-trained consultant surgeon, and if you or someone you care about has been diagnosed with stage 4 pancreatic cancer and you're wondering about symptom control and quality of life, you're in the right place. I know this diagnosis can feel overwhelming, not just for patients, but for families watching someone they love face this challenge. But today we're going to talk about real practical ways to manage symptoms, improve quality of life, and maintain dignity during treatment. Stage 4 pancreatic cancer means the cancer has spread beyond the pancreas to distant organs, like the liver, lungs, or peritoneum, that lining around your abdominal organs. Most patients with pancreatic cancer, about 80 to 85%, present with either stage 4 disease or locally advanced disease at diagnosis. This matters to you personally, because understanding where you are guides what symptoms you're likely to face, and what treatments will focus on quality of life rather than cure. Let me walk you through the 7 main symptom categories you need to know about, and I'll be specific about what to watch for. These include pain, jaundice, weight loss, and cachexia, nausea and vomiting, pancreatic exocrine insufficiency, psychological burden, and ascites. Understanding each of these will help you know what to expect and how to manage them effectively. Pain is often the major presenting symptom, and here's what makes pancreatic cancer pain distinctive. It's typically a gnawing, visceral quality pain centered in your upper abdomen that radiates bilaterally under your ribs and straight through to your mid-back. Patients describe it as a deep, boring pain that worsens when lying flat and often improves when leaning forward. The pain comes from the tumor pressing on the celiac plexus. That's a dense network of nerves right in front of your spine. Jaundice appears in about 56% of patients at diagnosis. Jaundice from pancreatic cancer is usually progressive, causing your skin and the whites of your eyes to turn yellow, your urine to darken to a tea color, and your stools to become pale or clay-colored. You'll also experience intense itching, medically called pruritus, that can be absolutely miserable and disruptive to sleep. Unrelieved jaundice increases your risk for a serious infection called cholangitis. Weight loss affects a staggering 85% of patients, and cachexia, that's an accelerated loss of skeletal muscle in the context of chronic inflammation, occurs in up to 80% of patients with metastatic disease. This isn't just about eating less. Contributing factors include inappropriately accelerated resting energy expenditure, anorexia, alterations in nutrient metabolism, with increased protein breakdown and altered pancreatic exocrine function. Pancreatic enzyme insufficiency affects 64 to 100% of patients with pancreatic cancer, even those who haven't had surgery. The main clinical manifestation is weight loss, because patients develop fat malabsorption and steatorrhea. That's fatty, difficult to flush stools, though many patients limit fat intake so dramatically that these classic stool changes may not appear. Despite expert recommendations, pancreatic enzyme replacement therapy is dramatically underutilized. Approximately 51% of patients experience nausea at diagnosis. Up to 60% of patients with pancreatic cancer have delayed emptying of stomach without evidence of actual tumor invasion into the stomach or duodenum. A possible explanation is tumor infiltration into the nerve plexuses that control stomach function. About 15 to 20% of patients will develop duodenal obstruction leading to gastric outlet obstruction, though it's typically not present at initial diagnosis. The diagnosis of cancer is unsettling to any patient, but the knowledge of the aggressive nature of metastatic pancreatic cancer may lead to adjustment disorder, depression, and anxiety. Patients who are depressed experience a significant worsening of their quality of life and have more intense pain compared with those who are not depressed. A systematic review found that depressive symptoms were a prodrome, an early warning sign, in approximately 38 to 45% of patients newly diagnosed. Ascites, fluid accumulation in the abdomen, can be due to peritoneal metastases or secondary to portal vein compression by the tumor. Patients with malignant ascites can experience abdominal discomfort, nausea, vomiting, and difficulty breathing from the pressure of the fluid against the anterior abdominal wall and diaphragm. For most patients, appearance of ascites herald's progressive disease. It is important that symptoms are well managed at this stage. For pain management, keep a pain diary noting intensity on a scale of 0 to 10 timing, what makes it better or worse, and current medication effectiveness. Try leaning forward when sitting. Many patients find this position reduces pancreatic pain. Apply heating pads to the mid-back area where pain radiates for 15 to 20-minute sessions. Ask family members to help you track opioid doses and side effects. If prescribed pancreatic enzymes, take them at the start, middle, and near the end of each meal, not just once before eating. The typical dose is 30,000 international units of pancreatic lipase, with each full meal half that dose with snacks. That's equivalent to approximately 90,000 USP units. Eat frequent small meals. Aim for 6 small meals rather than 3 large ones. Focus on easily digestible foods, and don't restrict fat completely. For managing nausea, eat smaller, more frequent meals to avoid overwhelming your stomach. Try ginger tea or ginger candies, which many patients find helpful. Keep crackers by your bedside for morning nausea. Avoid lying flat immediately after eating, and remain upright or semi-upright for at least 30 minutes after meals. There are effective anti-nausea medication. These can be taken in combination. About pain control, ask your doctor. I'm experiencing pain rated number out of 10 in location. My current medication provides relief for only duration. What adjustments can we make? Would I be a candidate for celiac plexus neurolysis? What are the benefits and risks? My pain seems neuropathic. Burning shooting quality. Should we add medications like gabapentin pregabalin or duloxetine? What opioid dose adjustments can we make, and how do we manage side effects? Early celiac plexus neurolysis provides better pain control, less opioid consumption, and better quality of life, compared with waiting until after failure to obtain pain relief with strong opioids alone. Success rates range from 50 to 80% in multiple studies. This is an important option to discuss with your healthcare team, especially if pain is not well controlled with medications. About jaundice and biliary obstruction, ask your doctor. What type of stent would be most appropriate, metal or plastic? How long does stent patency typically last? And what are warning signs of stent failure? What symptoms suggest cholangitis that would require urgent attention? These questions will help you understand your treatment options and know when to seek immediate medical care. About nutrition and weight loss, ask, should I be taking pancreatic enzyme replacement? What dose? Would consultation with a dietitian specializing in cancer care be helpful? Are there medications to stimulate appetite that might help? What are realistic expectations for maintaining or regaining weight? These conversations ensure you receive comprehensive nutritional support. About gastric outlet obstruction, ask, would endoscopic stenting or surgical bypass be more appropriate for my situation? What are the success rates and complication rates of each approach? If I develop early satiety or vomiting after meals, what's the timeline for intervention? Understanding these options helps you make informed decisions if obstruction develops. About chemotherapy options, ask, given my performance status and symptom burden, what chemotherapy regimen would you recommend? FOLFIRINOX gemcitabine plus nab-paclitaxel or NALIRIFOX. What are realistic expectations for symptom improvement with chemotherapy? How will we monitor treatment effectiveness and manage side effects? For medically fit patients with metastatic pancreatic cancer, gemcitabine plus nab-paclitaxel improved median overall survival to 8.5 months compared to 6.7 months with gemcitabine alone. FOLFIRINOX showed median survival of 11.1 months in selected patients. About palliative care, ask your doctor. When should we involve palliative care services? What specific help can they provide? What support is available for my family members who are caring for me? Palliative care is not the same as hospice and can be involved early to help manage symptoms and improve quality of life alongside active treatment. Contact your healthcare team immediately if you experience fever above 38 degrees Celsius or 100.4 degrees Fahrenheit with jaundice indicating possible cholangitis. Sudden worsening of abdominal pain not controlled by usual medications. Persistent vomiting preventing you from keeping down food fluids or medications. New or worsening shortness of breath or chest pain. These symptoms require urgent medical evaluation. Also seek urgent care for signs of bleeding, including black tarry stools, vomiting blood or unusual bruising. Confusion, disorientation, or marked drowsiness, which may indicate medication side effects or metabolic changes. Leg swelling, warmth, or pain suggesting possible blood clot. Pancreatic cancer has 4 to 7 times higher risk of venous thromboembolism than other cancers. Don't hesitate to contact your medical team with these symptoms. Stage 4 pancreatic cancer may cause multiple symptoms, but effective symptom control is possible through combinations of medication procedures like stent placement and nerve blocks, pancreatic enzyme replacement, and nutritional support. One of the most important steps is to seek early involvement of palliative care team at diagnosis to help you with preventative strategies, mental and physical well-being, and improve your quality of life. I have outlined several reputable resources here, which you may find valuable for further information on this topic. All links are available in the description below. Thank you for watching.